Hi, my name is Dr. Kerry Tapuzian, and you're watching the Ask Dr. T show. Today's questions are related to umbilical cord stem cells, and the most common question that patients will ask are, what are the differences between the different stem cells? Well, you've got umbilical cord stem cells, you've got stem cells that are from bone marrow, which are coming from you, and there's also stem cells from adipose tissue, which also come from you. The difference is that the older that stem cells are, the worse they work. Okay, so if you're like me and you're a little bit older, your stem cells aren't going to work as good. Okay, so when you're using umbilical cord stem cells, they're fresh, they're young stem cells, and they are able to replicate faster, and they're also able to excrete the different growth factors, trophic factors that cause a condition in your body.
Brought to you by PF Flyers with a magic wedge that helps you run your fastest and jump your highest.
So, for example, stem cells, what they do is they'll go to a certain area of your body, and they won't necessarily say, oh, I'm going to turn into this type of cell. What they do is they kind of excrete these different products that tell your body what to do. So, for example, if you need to build new cartilage, they don't necessarily make cartilage. They tell your body to start making cartilage, okay? So, umbilical cord stem cells, young stem cells, work really good that way. If you take your stem cells, let's say you're 50, 60 years old, okay? Your stem cells are older. They don't work as good. They don't excrete these products as good. They don't duplicate as well, okay? And if you have any type of chronic condition, okay, or autoimmune condition, they work even less. There's all kinds of studies that show this. Another thing that is commonly asked is, what do they treat? Well, to know what they treat, you have to understand what their actions are. And stem cells have four major actions, okay? They control inflammation, they modulate the immune system, they stimulate regeneration, and they reduce scarring, okay? So based on those four actions, you can get an idea of what kind of things that they'll treat. So, for example, any type of autoimmune condition, anything that's related to inflammation, arthritis, osteoarthritis, rheumatoid arthritis, MS, multiple sclerosis, heart failure, congestive heart failure, autism, because autism is an inflammatory condition of the brain, Parkinson's, dementia, Alzheimer's disease, and the list goes on. I personally would recommend that you take the disease that you're interested in finding out if stem cells will help, and you Google it. You say umbilical cord stem cells, and then you put the condition that you're looking for next to it, and you do a search. And what you want to do is you want to look for articles, especially from articles from the National Institute of Health, NIH, and you can find those. You want to try to stay away from websites that are advertising for stem cells. You want to look for specific articles. The other thing you could do is you could go straight to Google Scholar, which is a specific website that doesn't have advertising and it just has scientific articles. One of the other questions that are asked are, how are stem cells given? Well, they can be given three ways. They can be given intravenously, which is one of the most common ways that we do it. They can also be given into a joint, okay, intra-articularly, for example, into a knee, into a hip, into a shoulder, and they can also be given subcutaneously or into a specific soft tissue. For example, I injected my rotator cuff because I had two tendons that were partially torn. So I found out where the exact tears were by getting an MRI, and then I injected the stem cells right into that area. Another really common question that's asked is, are they safe? Well, they're extremely safe. There have been 300,000 stem cell injections performed throughout the world, and there's no major side effects. I've been performing stem cell therapy for over a year, and I have had no complications with any patients. The only problem I've had with some patients is some mild fatigue for about 2 weeks after the injection. Okay, any other questions out there? So if you do have any other questions, you can email me at drthelpdesk@gmail.com. This is Dr. Kerry Tapuzian, and you've been watching the Ask Dr. T show. See you later.